Welcome to the Buzz on Business. My name is Christine Stump with Advantage Tax and Accounting Solutions. I'm here today with 3 businesses from our local community. We'll be back in a few minutes. Hi, welcome back to the Buzz on Business. We're here with Dr. Mark Mecham with the Cleveland Clinic in Brunswick. Hi, Dr. Mecham.
Good morning.
Good morning. How are you doing today?
I'm doing great. Thanks for having me.
You're welcome. Can you tell us a little bit about yourself?
Sure. I'm a family physician and the medical director for the Brunswick Family Health Center here in Brunswick. I came to this area in 1993. When there was nothing in Brunswick from the Burger King to the urgent care building except for the old lady's house next to the lake. Mm-hmm. That was the only thing that was there.
I remember that.
And anyone who's driven up and down 303 lately knows how much has changed since then. I've got 2 children. Hunter is 17 and Madeline is 14. We do a lot of fishing up in Lake Erie. We do some camping outdoor activity. My daughter raises ball pythons.
Interesting.
So, yeah, and I'm very excited for what's going on here in Brunswick with our building and our services.
Can you tell us more about the new building and
Absolutely, sure. Well, for those who are familiar with our practice, I joined Telesiak Williams and Kane in 1993. And we affiliated with the Cleveland Clinic in 1997. Our building has been, our family health center has been open for about 6 years now. And we really saw a need to expand services to provide 24/7 emergency care for Brunswick residents. Mm-hmm. And we added on basically double the size of our building, went from 38,000 square feet to 79,000 square feet, and opened a full service emergency department, staffed with board certified emergency room physicians. And it added some imaging. We added laboratory services, have a helipad for taking out critically ill patients, mm-hmm. Which we have been using already, started using within a couple days of opening our building. So it's very exciting. In the Family Health Center, we also now have a walk-in clinic where patients can come in for low-level type sprains and strains, cold and flu, mm-hmm. rashes, low-level things, no appointment is required. You can walk in and it's billed just like an office visit. So we now have that in addition. So we have family medicine, pediatrics, internal medicine, gynecology, neurology, nephrology, cardiology, pulmonology, physical therapy. We have a CT scanner now. We have had an MRI, as I mentioned, lab services before. And I think that's about everyone we have there.
Wow.
Yeah.
Pretty impressive.
So lots going on, yeah. Absolutely. Yeah.
So where do you see the, with the Affordable Care Act, how is that affecting?
Well, as anyone who's been watching the newspapers and seen Toby Cosgrove talking on television, he has been very active with the president. President called him recently and invited him to take his expertise to run the VA system, which he wisely chose not mm-hmm. to. We have a lot to do here. We basically are learning how to do more with less. We're mm-hmm. Putting an emphasis on quality in medical care over quantity, which is mm-hmm. traditionally how you've been paid in medicine is for numbers, and now we're working on being paid for quality. So better outcomes, better services, more time spent with patient, maybe not the physician himself, but more time with patients. We actually have a number of care models that we're working on now. We have, we're going to be starting something called shared medical appointments, where, for example, hypertension, high blood pressure, people will come in with a group of people and have a visit like that, and then have an individual time with the physician in addition to that. We're working on something called team care, which is where we have, instead of one medical assistant, we have two medical assistants that work with our doctors, and they're able to spend more time in the room with the patient, so the patient really has longer access to medical personnel than they had before, and people like it a lot. So there's just a number of things that we're doing. Medicine's changing. It's changing everywhere, and thanks to our efforts and the expertise, at the thought leaders of the Cleveland Clinic, we're really able to bring a lot of that here to Brunswick.
Is that what you think makes Cleveland Clinic stand out? I mean, Cleveland Clinic has a great reputation.
Cleveland Clinic does have a good reputation, and certainly they have always had, my personal thoughts, I've been inside and outside the Cleveland Clinic, so I've been on both sides of the fence. I've always been impressed with the physicians and their care for patients. I think the specific advantages that we have now, one of the main one is the shared medical chart through the Epic system. So if you are seen, for example, anywhere within the Cleveland Clinic, your doctor gets notice of that. You know what was done and what medicines were given and all that. Or if one of our patients from our building, for example, ends up downtown, either with a specialist or in the emergency room, they have a full record of what we did that day in the office. We have my chart so that you can have access to parts of your chart. You can have access to office notes now. You can have access to lab values. You can schedule appointments. You can do medication renewals, all those things online now. So it saves you having to spend time on the phone, which none of us likes to do.
Do you have any future plans for growing even more in Brunswick?
Well, actually, the second floor of the emergency department, the first floor of the new addition, the first floor is emergency department. Second floor is now shelled space. And what we're going to be doing is expanding our primary care access there and put some of those models I've discussed into practice there in the in that second floor space. So we're going to expand our primary care and put some of these new models into effect there. So that will leave us more room for specialty care in our main building.
Great. Well, thank you, Dr. Mecham. It sounds like Brunswick is very lucky to have the Cleveland Clinic and doctors like yourself. Thank you very much.
Well, thank you.
And we'll be right back.